Welcome to our video on how to care for your temporary dental crown. There are several steps to follow to care for your temporary dental crown. Learn what foods to avoid while the crown is in place. Then, learn how to remove the crown once it's time. In addition, here are some helpful tips for aftercare. This video will provide you with an overview of the temporary dental crown process and answer your most common questions. Hopefully, you'll feel more confident about completing your dental procedure in the future. Care for a temporary dental crown. To care for a temporary dental crown, you must be cautious when you brush your teeth. While it is important to brush your teeth every day, you should be extra careful when using floss because pulling the floss down the sides of the tooth may irritate the crown. Also, avoid using an electric toothbrush with a temporary crown, which could damage the tooth. Instead, use a soft toothbrush, such as one made for children. The crown will be attached to your tooth with temporary cement. It isn't meant to remain in place permanently, so make sure you practice proper oral hygiene when you wear a temporary crown. Brushing twice a day for 2 minutes and rinsing often is recommended. You should also use dental floss at the gum line to prevent accidental removal. It is important that you refrain from eating sticky and sugary foods while your temporary is in place. You should also avoid biting on the side of your mouth where the temporary crown is located. This is to reduce discomfort and keep the temporary crown in place. You can use an antibacterial mouthwash to reduce the chances of infection and inflammation. After placing your temporary dental crown, you should brush your teeth and floss them once daily. You should also avoid eating anything hard or sticky for the first 30 minutes. If you are unable to brush your teeth for the first 2 hours, the temporary crown may be loose and may fall off. The final restoration will be made from a permanent tooth-colored material. However, while a temporary dental crown looks like a permanent one, it can still affect the underlying tooth and gum structure. The temporary crown protects the teeth underneath the permanent crown while they are being created. Its temporary appearance makes it look like other teeth, but the final restoration will be much stronger. A temporary dental crown can only last for a few weeks and its strength will eventually weaken. A temporary dental crown can be uncomfortable, and you may experience some minor pain while wearing it. It will be taller than the rest of your teeth and may press against your teeth. This can lead to inflammation and throbbing pain, which are signs of infection. However, if your temporary dental crown is still causing you pain, call your dentist immediately for emergency treatment. So, the first week of your new temporary crown should be as comfortable as possible for you. It is important to refrain from chewing on hard objects while waiting for your permanent dental crown. Chewing on hard objects will put additional pressure on the teeth and the dental crown. These habits can wear down your teeth and damage the crown. So, while your temporary dental crown is in place, try to avoid chewing on hard objects such as ice. By doing this, you will prevent the teeth from wearing down and breaking the crown. Foods to avoid while caring for a temporary crown. After a temporary crown has been placed, you may be wondering what foods to avoid, if any. To minimize the chances of causing further stress to the crown, you should avoid certain types of food. Listed below are some of the most common things that you should avoid. As a rule of thumb, soft foods are the best choice. For example, yogurt or curried foods are ideal choices. However, you should avoid chewing on hard foods or ice cream. Also, avoid extreme temperatures while eating or drinking. Drinking water that is at room temperature is also a good idea. Crunchy and raw vegetables may irritate your tooth, so it is best to avoid them until you've got your permanent crown installed. Sticky foods, like raisins, are best avoided until the permanent crown has bonded to your teeth. Their high sugar content can cause cavities, which lead to tooth decay. Avoid these foods while you're waiting for your new crown to settle. This will help ensure your temporary crown stays put. While the temporary crown is attached with temporary cement, you should avoid chewing on anything hard or chewy. The temporary crown will be in place for a few weeks, so it will be best to avoid chewy or crunchy foods. While the temporary crown is in place, you should avoid chewy and tough foods. This is to ensure that the crown stays in place and remains fully functional. The pulp of the tooth remains healthy, reducing the risk of tooth decay. The survival rate after 15 years decreased from 90% to 81%. Some of the foods that you should avoid while caring for a temporary crown are softer and less sticky. Raw vegetables are tough and may damage the crown. Cooked versions are softer and won't harm your temporary dental crown. However, it is important to note that a temporary dental crown is more fragile than a permanent one, so you should avoid chewy foods for at least 30 minutes after you've had it placed. The cement that holds your temporary crown in place is weaker than that of a permanent one. You should avoid chewing on sticky, hard, or sticky foods. Also, do not chew gum or ice. Hard bread, ice, and sticky treats can pull your temporary crown out of place. Avoid chewing gum as well. You may also want to avoid hard foods for a few weeks. However, it is not always possible to avoid chewing. When it comes to chewing, you should use the opposite side of the mouth to prevent the crown from becoming dislodged. Additionally, flossing should be done by sliding the floss out rather than lifting it. Also, avoid hard and crunchy foods for at least 24 hours after your permanent dental crown has been placed. The same applies to gums. Sticky candies, like grapes, can cause the crown to break. Care for a temporary crown after it comes off. A temporary crown may fall out before the second appointment. Because the teeth are weaker than the rest of the mouth, this type of crown can fall off easily. Care for a temporary crown after it comes off will vary depending on the circumstances. You should avoid eating hard, sticky or chewy foods while the temporary crown is on. Rinse the tooth thoroughly to remove any loose particles. If the crown does fall off, call the office immediately to rescind it. If your temporary crown falls off, take it to the dentist right away. Rinse out the area with warm water, and run your tongue over the exposed tooth edges to remove any debris. Be sure to share any jagged or smooth edges with your dentist. Do not try to eat or drink anything directly during the restoration. In addition, do not floss the area where the temporary crown fell off. Your dentist can replace the temporary crown if the original one falls off. Floss gently on the teeth with a soft toothbrush. Make sure to avoid chewing on the temporary crown, which may cause sensitivity. Use ibuprofen to help relieve pain and discomfort, and rinse your mouth with warm salt water to promote healing. To minimize discomfort, do not floss between the two teeth. Instead, hold the temp of the floss and slide it out. After the temporary crown has come off, be sure to call your dentist as soon as possible. A temporary crown can come off during the weekend. If you aren't able to get to your dentist during the weekend, leave it off until the next Monday. If you do not have time for an appointment, you can re-cement the temporary crown yourself. A denture adhesive, such as Dentemp, is readily available in toothpaste aisles. Follow the instructions on the package carefully. First, remove the old cement inside the crown. Then, dry the tooth thoroughly. Once the tooth is dry, push the temporary crown with the cement inside. If a temporary crown comes off too soon, it may come off without any visible damage. If so, you can reinsert it with toothpaste. Although toothpaste can help reduce sensitivity after a temporary comes off, it cannot hold it in place while eating or drinking. Denture adhesives can be purchased at any drugstore. If the temporary crown is still in place, you should bring it back to your dentist immediately. It is important to brush and floss regularly after your temporary comes off. Brushing your teeth regularly will reduce the risk of bacteria forming around the temporary. Brushing your teeth with a toothbrush and toothpaste will help prevent plaque from forming around the temporary. Flossing should be done carefully, threading the floss through the gum line and gently sliding it out of the gaps between the teeth. Do not chew on your temporary as it may be prone to damage. Thanks for watching. Please like, comment, and subscribe for more.